have been for the last couple of months experiencing very contentious changes in our health financing in Kenya.
Yeah.
I don't know if you're currently covered by the
one and only.
I don't even know if we should mention names, but SHA, SHIFT, the whole conversation. What's your professional assessment of how to improve public health financing? And, is there any good that can be found from this current model that the Kenyan government has decided to take? And I'm not advocating everyone should pay taxes, but I think sometimes we're seeing situations where, people who have to go for kidney dialysis, for example, they're not accessing the healthcare they did in the previous regime.
The emergency patients. And we heard horror stories, unfortunately, about all of the patients that fall into that gap in the transition between NHIF and SHA. In theory and now in practice, because it started the rollout, it's already there, the packages, and all of that. In theory, it was a great change.
Okay.
I do think they are really trying to expand into covering more disease areas.
Okay.
Covering more diagnosis and screening, covering more treatment. They are trying to shift in between the investments in different packages to cover more, basically. So again, in theory, it's great. It was great. It's still great. I believe from our discussions, they still have I think every year or 2 years that they review the packages and they review the estimates of expenditure in each package. I think where we have failed, and allow me to say we, again, I believe that Egyptian, Kenyan, South African, Botswanian, Senegalese, we're all one people.
All the same.
Yeah. Absolutely. And we have the rights to support each other, but also criticize each other. So where we have failed is the implementation part. And this is something that I have been seeing in lots of policies in Kenya. Kenya is leading into writing policies and guidelines.
Yeah, I'm not surprised.
Yeah, we're very good at that.
Yeah.
We produced them pretty early.
Bright minds putting together some amazing guidelines adapted by different countries, including Southeast and the Asian tigers, as I said, way back.
Absolutely.
1970s, 60s.
Even in the region, whenever we want to benchmark on a topic, on a module, on a guideline, on a policy draft, we say look at the Kenyan one.
Wow.
So absolutely. So yeah, we draft amazing documents, but I think in the process of implementing, we thought it could be easier. We thought it could be smoother. And maybe this is something that we have, again, collectively as one big African nation, that we need to do a little bit deeper risk assessment before we jump into projects.
Okay. Say more about that.
So if risks are anticipated, there is a mitigation plan around it, and it reduces the magnitude of the risk.